Hi, how are you? This is Damaris Maria Grossman, and this is the Mindfully Integrative Show. And today we have an amazing mindful chat with Dr. Swathi, and she is going to teach and talk to you about all the wonderful things that she does in her practice with her clients and her patients, and how she's kind of integrated her health into many ways. So she has a lot to share with you, and I can't wait for her and for those to meet and see her. Thanks so much for being on the show.
Oh, thank you so much for having me.
I really appreciate it. And as I say to those that are first listening, what's a little fun fact that someone may not know about you?
Ooh, a little fun fact. I guess it's associated with my hobby. I really love to travel. And so something people may not know about me is that I've been to over 30 countries, and most of them have been solo backpacking trips.
Solo backpacking. Oh, cool.
Mhm.
That's really neat. What do you have any favorites or things that you liked at in different time in your life, certain periods?
One of my favorite cities, I have to say, is Ho Chi Minh in Vietnam. I really love Ho Chi Minh. I would also say Helsinki is a place I would move. So I loved it there as well.
What do you think was it that brought you to either one of those places that was like drawing to stay or to go back?
I think it's the combination of the people that I met there. The people in both of the places were so kind.
Hmm,
And then the food was incredible. And just the overall, it just has this like atmosphere of inclusivity. I don't know how else to explain it. Like everyone is so diverse, but
that's
it still
beautiful.
feels like you can belong even though you're not from there.
Oh, that's really beautiful. I had a friend that had gone to Vietnam and said she absolutely loved it. She said it was
Oh,
just
well, the most
amazing.
underrated country I've ever been
Yeah, she had
to.
said that too. I think she went for some work for school or something, and she
Mhm.
said, "Oh, it ended up being amazing." So, yeah,
So
she had
great.
really enjoyed it. I love traveling too. I just haven't gotten as much. I mean, a little bit, but here and there. And then a couple of years ago, I did some in a van all around the country, and then I
Oh,
traveled in Europe
wow.
too, but not as much as I'd love to say. I'd love to do more for sure.
And everything was put on pause the past few years too.
Yeah, yeah. So I'm hoping, as my little ones get a little bit older, I'll
Yeah.
get back into more
Oh,
traveling too.
great.
Mm. So let's get back into you and talk more about how you're making a difference for yourself, obviously, and for others. So let's kind of get into where did you start, Dr. Swathi? So
Mhm.
um, your story, obviously, your medical degree, but also just in your history, just like how did it get it to where you are now? Because not everybody says, hey, I want to just do something in integrative health. I mean, that's like a
Absolutely.
conversation, there's usually a turning point and or something that makes or someone in their family that's given them a different thing.
Yeah, no, absolutely. So I was someone who was always interested in integrative and preventative health. And
Yeah.
I thought as a pharmacist, and that was something that I'd be able to be a part of because in my, in my experience before pharmacy school, I saw pharmacists on the corner of, and in every single drugstore. But also in the drugstores, there are a bunch of supplements, there are other like things that can optimize health and wellness. So I thought that pharmacists, would really have that balance between the two. But of course, I went to pharmacy school, graduated, and noticed that that was not the focus of the curriculum. And
Hmm.
so I really wanted to focus what I'm doing on that because when the way that I define integrative health, and I call myself an integrative health pharmacist, really what that means to me is that we're able to integrate every which health and wellness and healing modality and really not only integrate them, not only combine them, but put the patient at the center of the discussion. And so we call it patient-centered shared decision making. And so that is really exactly what it sounds like, laying out all the potential options of all these modalities. Someone could be more interested in meditation or nutrition or supplementation or optimizing their movement, or like there's so many different ways that we can improve our daily living really. And so I think the most important thing is seeing what the patient's treatment goals are and being able to lay out all the different options and help guide them on a journey that helps them figure out what fits best with their lifestyle and of course their goals. So that's a little bit about how I see integrative health, and I see it just evolving and changing every day. And it's so exciting. Honestly, it's such a great area to be in, because there's so much change and so many more people becoming a part of our, like small circle, which
I
is
know,
really
or a
nice.
small little tribe, as I call it, but I'm so
Yeah,
excited about it.
definitely.
Yeah,
Yeah.
as a family nurse practitioner, and and when I got my doctorate in that integrative space, and I could not agree with you more. Patient centered, just a different conversation of that it's okay to think outside of just that one pill or that one medicine, and that's what you're doing is so important, because I think people are afraid to talk about, oh, they just gave me this one blood pressure medication. Is there
Mhm.
anything else for me? And you're like, and when we don't talk outside of that, you go, there is more, and you're here to bring that to everyone. And I, yeah, me,
Exactly.
I hands full, I'm totally with you.
And I think it's so important too for more pharmacists and more healthcare professionals like us to get involved in this space, because there's so much knowledge that we bring that is so important to, of course, helping our patients, but that paired with the preventative and curative, really putting those together is amazing. And so that's why when I decided I wanted to do this, there's no clear path for a pharmacist who wants to
Mhm.
do this.
Right. Yeah,
And
you kind of
so
made your own
I,
path, right?
yeah, I did. I did. So I found an incredible mentor, and we decided to start the first ever and still only pharmacy residency program, so postdoctoral training program for pharmacists interested in pursuing this unconventional path. So
Oh,
I was
I
able
love
to,
it. Oh my God,
oh,
congratulations.
thank you. Yeah, so we were
That's
able to
really
create the
exciting. I know I'm
program.
hoping to at some point do more work for integrative nurse for nurse. I
Mhm.
mean, there is a big platform for us, but on the NP side, because
Yeah.
I'm just a big I'm a big obviously we're big proponents of it for both of
Mhm.
us in our professions.
Yeah. Mhm.
That's amazing. That congratulations. That must have been a big step in the right way.
Definitely. Definitely. Mhm.
And how do you feel that's been? So let's talk, if you want to talk more about how that is with your clinician side, with the ones that
Mhm.
you've taught, and then also discuss maybe like a client or patient that you've worked with.
Yeah, absolutely. So in my residency and then a bit after that as well, I've had a chance to interact with a lot of different patients in a lot of different scenarios. And so my training in particular was at both the independent natural pharmacy, which was an incredible place to learn, because as I was delving into homeopathy or clinical nutrition, and I had questions about those things or traditional Chinese medicine, the place where I trained actually had licensed practitioners in all of those realms. So I was able to go to them and shadow them and ask them questions and really learn from the experts. So that was amazing. And then I also was able to train at a clinic. So it was an HIV focused clinic, a nonprofit clinic, both in the LA area. And so there I
Oh,
was able
cool.
to actually implement a medical therapy management program, which is just like a fancy pharmacy term for the opportunity to sit down one on one with the patient and go through their medications. But because I have my background, I actually called it like a comprehensive MTM program. So I was able to sit down with them, talk about their medications, but also address any concerns they had with nutrition and, any other wellness modality. And a lot of them were interested in cannabis and CBD. So I was able to shed some light and educate them on that. So that has been like, those two are really incredible, honestly, for training and really getting such a wide variety of experience so early on in my career. And then after that, I've had a chance to work on some online courses. And so I've gotten to delve into education in that way. And I helped write the first ever online course for pharmacists, for practitioners interested in learning about integrating cannabis as medicine into their entire scope of practice. So that was amazing. And then also more recently, I was able to put together a webinar series with my previous mentor, the one who I started the residency program with. And that was also focused on healthcare professionals. So a lot of what I've done, I guess, on the like online education side has been for practitioners, but something that I'm really excited about and something that I really enjoy is still being able to educate not only providers, but also patients. And so I've been able to work with some online platforms and provide my insight, and whether that's in an article or a
Mm-hmm.
quote or something like that. And I'm still able to provide it from that educational standpoint. At the current moment, I don't work with patients as much
As you used
one-on-one
to.
anymore.
Okay.
Mhm. Yeah,
Bec-
but I still have a chance to like impact people on a wider
Oh, of
scale.
course. I mean,
Mhm.
educating them. I mean, just by being on this podcast, people
Mhm.
are going to reach out to you and find you and be educated and find your insight. And every little, pearl that someone can find out and learn is important,
Yeah.
and you've made a difference. So
Mhm.
you don't have to be one-on-one to make a difference nowadays. It's especially with
Exactly.
the power of, and it's good to have, quality educated, as evidence-based and quality information from individuals like us, professionals that can, people can reach out to instead of just kind of looking at, whatever's on the internet or
And that's
such.
honestly the most important thing that you just mentioned is I call it like evidence-based, scientifically driven content. That is always what I go for. And I think especially being in this space, there's
Yeah,
so much misinformation
a
out
lot.
there.
There's a lot of
And
misinformation.
so, yeah, exactly. And so a lot of people are, I feel like at this point we are at the age of the conscious consumer, and consumers want to know this information. Patients really want to know what they can do to really better their lives of them for themselves, for their loved ones, and everyone in their community. And so if we can be a part of educating, that's just the best thing that we could do as healthcare professionals to help them, and empower them to make the right decision for them.
Yeah, you bring up a great point. To have them be empowered more,
Mhm.
to make changes is so utterly important. Um, when you've worked with these, now that you've kind of transitioned a lot and with the clinicians, how has that been? Was that a little challenging, or, I know for in my profession, there's the haves or those that don't believe and those that don't do agree, and those that are just like always skeptical. Did you have any challenges with your post residency with people like even like wanting to, is this an elective, or is this partial, or is this they take it after they take it's post residency, so they choose to take it, correct?
Yeah, yeah. So you have to like apply and be selected and make sure it's like the right fit
Fit,
on
right.
both ends. Yeah. So it's a postdoctoral training, so it is not required by any
Okay.
means.
Hmm.
And so I mean, it's amazing that that many people are interested in it. And I keep getting
Yeah.
inquiries about it. So there definitely is like a growing interest. But and I would say like growing interest from the patient, wow, from the student population,
Yeah,
of
yeah, of
people who
course.
are joining the workforce and they want to be a part of this. So that's amazing. But from the current practitioner standpoint, as you mentioned, it's being in the space is very polarized. I would say there
Hmm.
are people in the space who are very, only one way or the other. And I try to be one of those people that's in between the two. Like I see the value of
Well,
supplements and nutrition, but I also see the value of prescription
of
medication
course. That's why we're
when
integrative.
exactly, exactly.
That is why
But
we're
it's
integrative.
interesting. A
I
lot
was
of
like, I talk about it all the time.
yeah, no, I agree, but I feel like a lot of people in this space that I meet, like the holistic space overall, they're very one or the other.
They are. Hmm.
And then I would also argue that too in like the conventional space, people are very like one-sided or the
Yeah,
other.
they're right.
So trying to bridge that with science, I always just come back to
Bridge that. Oh, you beautifully said it. I could not have
yeah.
agreed with you more. I
Mhm.
explain to someone on a daily basis, just because I'm integrative does not mean I don't believe in evidence-based or
Yeah,
science.
it's like you have to
I'm a
give a
highly
disclaimer
educated
every
woman and
time.
you're a highly
Yeah.
educated woman, doctor. Like, and we are here to make a difference and to help. The priority is helping themselves, helping our patients, and to do it safely.
Mhm.
It doesn't always have to be one, and I think that's where we're trying to have the conversation, and I mean that's why I started this podcast, to get people to just talk about things, and be okay with it. Not the I guess it's a gray area, maybe that's the
Mhm.
word. I mean, it's a whole other conversation we could have probably on another podcast. Um, but no, you bring up such a great point. When you started to kind of go in this direction, right? I know that you said that you've had in your family and you saw it, and like you were at, what was there anything that additionally drove you to this? Like any of like health issues for yourself or family health issues that you were like, I need to do something more?
I wouldn't say that it was anything like personal
Yeah.
necessarily, but I think it was just observing as a pharmacist when I started doing rotations and started like really started fielding questions from a lot of family members and friends that wanted to know more about pharmacy, they had questions about, for example, a lot of people have questions on drug supplement interactions or drug herb interactions. And I realized that in my curriculum, that was not really something I could answer. And so I had to go and figure out what resources were out there and then what else we could do to learn that kind of information to field those types of questions. And I think that like that was a big catalyst. The other one was being a part of and starting, actually, when I was in pharmacy school, I was able to start a diabetes education program at a nonprofit clinic. And so
Oh,
there
that's
being
so
able to,
important.
oh yeah, absolutely. And so I was able to interact with so many patients. Like I still think about some of those patients. They were just so, it was so eye-opening, but they were just the kindest people. And so I was able to interact with them. And that was also a really shed a really big light for me on, from a patient perspective, what types of questions they had, and the same types of questions that kept coming up over and over again too.
What was like a main tip? I mean, I'm gonna ask you, like
Mhm.
what was like a mindful tip that you have for someone, but what was like a quick question that they would come up? Diabetes, I mean, I can imagine there's probably a bunch, but
Yeah, I think that a lot of people were confused with when people were like, oh, your sugar levels. People really wanted to know what that meant. So I was very like pleasantly
mm,
surprised with all these patients being so like genuinely interested in wanting to learn about it. And so these patients, it was a nonprofit clinic. They did not have to be there. They were going out of their way to try to better their, health and wellness. And so they were able to get free care. They were able to get free products and everything. And they valued it and they wanted to come and learn. So that was something that when they were like, oh, the doctor just left. So the doctor would come in, talk to them, or the NP, and then I would go
yeah.
in and talk to them after. And I was almost that in between person where they're able to be like, so the doctor said this, what does that mean? So I
Oh,
was
that's
able to
great. It
answer.
gives them extra questions.
Mhm.
And then did they always ask like what the numbers were or how much they should have in a day?
Yes, absolutely. That I was going to say, after they ask, what does sugar mean, and like how do I monitor sugar and things like that. So reviewing things like their glucose monitor, a lot of those types of questions that you would expect, I guess. But a lot of patients had questions about diet, a lot of
Good.
them.
No, I mean, they need to. I wish
Mhm.
they would have more conversations about it, right? I mean,
Yeah.
what you're putting in your mouth in your body is so
Mhm.
important.
Mhm.
Um, well, I think that's quite interesting. I think the more and more conversations that we have in that direction is utterly important.
Yeah.
Was there anything that you would like to share before we, go? A mindful way or mindful tip that you
Mhm.
would like to add in for the day?
Yeah. I mean, so many things. Like,
I know. If
um,
there's one for now, because I want them to reach out to you. So I want you to, see how, let them know how they can reach you also.
Yeah, no, absolutely. So I guess the one thing for now, I would say that has taken me a really long time. I think it's still like a process every single day that I go through to try to improve this. But I recently read this book called Untamed by Glennon Doyle, and she's incredible. I highly recommend to everyone. And she talks about this concept of being present and the importance of being present in the moment, and how that really helped her. She calls it actually like finding and embracing stillness. It's like really poetic and beautiful the way that she talks about it. And she gives very, like, of course, concrete examples to match with that, and how finding stillness and just like embodying the full you all the time and just being so comfortable in who you authentically are has like helped to lead her on such an incredible journey to where she is now as this like very accomplished author and mother and wife and everything. So
That sounds beautiful. I've not read her book, but I
it's
could not agree with her more.
Mhm.
The more that I am in tune with my inner self and that moment, I'm a better person. So,
Mhm.
and I try to talk to people each and every day about having these mindful ways, as I call it, but whatever that is, I want it. I want people, more and more people to get into it.
Absolutely. There's so many different things that we can do. And
Totally.
I think that that's one of the things that the thing I just mentioned, I think that's one of the things that everyone can do. But so many of the other practices, I think just comes down to what the patient or the person's interested in.
Right, right. What's your one that you really like doing for yourself?
The
Being in the
mindfulness
present.
tip.
Not even just mindfulness, just like your a mindful way, whether it's I call
Mhm.
it, but any integrative tip that you love to do for you. What's your
Yeah.
go-to?
Yeah. One of mine would be just like turning off everything and
Mm-hmm.
just being one with, the environment, wherever I am. So I actually really enjoy that. I found that silence has really brought me a lot of peace. And I really love that. So, and of course, silence can mean different things to different people. To me, it's not being distracted by anything.
Right.
And so to me, like going on a walk and not bringing my phone, not bringing anything that will distract me, and just taking in my surroundings, like feeling the air on my face and the breeze through my hair, like just those like very simple things, and trying to spend more time in nature and trying to plan weekend trips and things around that to try to disconnect to things so that I can feel really energized to reconnect during the week.
That's beautifully said. Thank you.
Mhm.
I hope people, as we're on these podcasts and connecting with them and doing these things, it's great. But it's kind of like me and you telling everyone it's okay to not listen to us, like unconnect for a second. And no, not even just. I could not agree with more. I just think people need to reset all the time,
Mhm.
in their day. I call it in the U for the mindfulness, unplug and reset.
Yeah, absolutely. Mhm.
So thank you so much for being on the show. And I would love to know how people can reach you. I mean, I'm going to have it in the show notes, but is there one website that they can reach you directly?
Yeah, you can reach me through my website. I have a message board there. So that's drswathi.com. So doctor spelled out DOCTORSWATHI.com. That's one way. Otherwise, you can follow me on Instagram, or you're also welcome to message me through that as well.
All right, wonderful. Well, thank you so much for being on the show. And thanks for those watching and listening. I appreciate it.
Oh, thank you so much for having me. I love having conversations like this. So
Yay.
anytime.
Of course. And I'd love to have you back again. We got to talk about that gray area and other
Yeah.
things.
Mhm.
But thanks, guys, for being and listening and watching. And you find and make sure you find a mindful way each and every day. Thanks. Bye.